Imagine this, you're at home, going about your day. Suddenly the room starts spinning. It's like being on a carousel that won't stop. You feel dizzy, unsteady, and nauseous. What you're experiencing is vertigo, a common but disorienting condition. Vertigo is more than just feeling dizzy. It's a false sense of movement, a feeling that you or your surroundings are spinning. This sensation can be brief or last for hours, even days. Vertigo can make everyday tasks feel impossible. Walking, standing, even just turning your head can become a challenge. While the experience can be frightening, understanding vertigo is the first step toward managing it. In the following sections, we'll delve into what causes this unsettling sensation and how it can be treated. Vertigo is often described as a spinning or whirling sensation. It can feel like the room is moving around you or like you're on a tilting platform. This illusion of movement is what makes vertigo so disorienting. Along with the spinning, you might experience dizziness, lightheadedness, or a feeling of unsteadiness. Vertigo isn't a disease in itself, but a symptom of an underlying issue. This underlying issue often lies within the vestibular system, the intricate system responsible for our sense of balance. To understand vertigo, we need to first understand how our body normally maintains equilibrium. Balance is something we often take for granted, yet it's a complex process involving multiple systems in our body. Our eyes, inner ears, muscles, and joints all work together to keep us upright and stable. The inner ear plays a crucial role in this balancing act. Within the inner ear lies the vestibular system, a tiny but mighty system that detects head movements. It uses fluid-filled canals and sensory hair cells to tell the brain about our head's position and motion. When we move our head, the fluid in the inner ear shifts, bending the sensory hair cells. This bending sends signals to the brain, which then instructs our muscles to adjust our posture and maintain balance. This intricate system ensures we can walk, turn, and move without toppling over. Section 4. Two sides of vertigo: peripheral versus central. Vertigo can be broadly classified into two types, peripheral and central. The difference lies in the location of the problem within the balance system. Peripheral vertigo, the most common type, originates in the inner ear or the nerve connecting the inner ear to the brain, known as the vestibular nerve. This type of vertigo often occurs suddenly and is associated with intense, short-lived episodes of spinning. Central vertigo, on the other hand, stems from a problem in the brain, specifically the cerebellum or brainstem, which are responsible for processing balance information. Central vertigo is less common but potentially more serious. Understanding the type of vertigo is crucial for determining the underlying cause and guiding treatment. In the next section, we'll explore some common causes of both peripheral and central vertigo. Section 5. Unraveling the causes of vertigo. There are numerous conditions that can disrupt the delicate balance system and lead to vertigo. Let's explore some of the common culprits. Benign paroxysmal positional vertigo, or BPPV, is the most common cause of vertigo triggered by specific head movements. It occurs when tiny calcium crystals in the inner ear become dislodged and interfere with the fluid movement, sending false signals to the brain. Vestibular neuritis is another condition that involves inflammation of the vestibular nerve, often caused by a viral infection. It leads to sudden intense vertigo that can last for days. Labyrinthitis, similar to vestibular neuritis, involves inflammation of the inner ear, but also affects hearing. It can cause vertigo, hearing loss, and tinnitus, which is a ringing in the ear. Meniere's disease affects the inner ear and is characterized by episodes of vertigo, hearing loss, tinnitus, and a feeling of fullness in the ear. The exact cause is unknown but may involve fluid buildup in the inner ear. Section 6. Seeking help and finding balance. Experiencing vertigo can be unsettling, but the good news is that most cases are treatable, and many resolve on their own. If you experience sudden or persistent vertigo, it's essential to consult a doctor to determine the underlying cause and receive appropriate treatment. Diagnosis typically involves a thorough medical history, physical examination, and tests to assess balance and inner ear function. These tests may include balance tests, which evaluate your balance and coordination, often involving standing on one leg or walking heel to toe. Eye movement tests track your eye movements to assess the function of the nerves controlling eye movement, which are closely linked to the balance system. In some cases, Imaging tests like MRI or CT scans may be recommended to rule out any structural abnormalities in the brain or inner ear. Treatment for vertigo depends on the underlying cause. For BPPV, a series of head movements known as the Epley Maneuver can help reposition the dislodged crystals in the inner ear, resolving the vertigo. Medications may be prescribed to alleviate symptoms like dizziness, nausea, and vomiting. Vestibular rehabilitation therapy, a specialized form of physical therapy, can help retrain the brain to compensate for balance problems. Remember, while vertigo can be a disorienting experience, it's often treatable with proper medical care. By understanding the causes and seeking timely medical attention, you can regain your balance and navigate the world with confidence.